initially drew you into the field of medicine, and how did you eventually specialize in Botox and cosmetic treatments?
So what brought me into the field of medicine? The ability to definitely give back and help patients, I think that's really what started. I had an experience when I was actually 23 years old. My mother was in the hospital, and during that time I had some experiences with providers, whether it be physicians or nurses, and I didn't have the greatest experience with that. And I think part of the things, or part of the motivation that led me to medicine, was the ability to have a little bit of control. And I've been a patient before, so I try to think about that when I treat my patients. I try to treat them like family, as if it were my brother, or if it was my mother or my father sitting there. And that's why I really just kind of approach it like that. I approach it as if I'm treating somebody that I know. So everybody that comes in, I try to treat them the same and give them 100%. So that was really kind of driving factor and motivation behind pursuing a career in healthcare. But I think it kind of took on a life of its own too. I think that my expectation was one thing, but actually going through the day-to-day and the journey was totally different. Sometimes you have an expectation and it doesn't really, you don't know what you're getting into until you really get there. So it's been a lot more rewarding than I thought it would be, for sure. What was the second part of the question?
How did you eventually decide to specialize in working with Botox and cosmetic type treatments?
Got you. So most of my training, residency, we got a lot of different training. So we got to work with people who needed things. So people who maybe have traumatic injuries, whether it be a car crash or a gunshot, or even like, so we see a broad range of patients who have infections, or maybe they have problems with their teeth and they need implants. So I was exposed to a lot in dental school and in residency. And I think just having mentors that were doing some of these procedures through rotations, that was my first exposure. And the more that I learned about it, the more I was exposed into it, I just think that it life of its own, and I was just more intrigued by the surgeries and the potential to kind of, provide a service that people want and not necessarily need.
For someone who's never heard of Botox, how would you explain it, what it is and how it works?
So for somebody who's never had or known about Botox, the simplest way to describe Botox is a toxin, right? It's something that is produced by a bacteria. And what Botox does is it will help to paralyze, or it will help paralyze the muscles and prevent you from using muscles as much to create muscles that create wrinkles in our faces. When we place Botox in these muscles, that works to relax them, so you no longer see the deep lines and the deep wrinkles that we see with aging.
Botox has become quite popular over the years. How have you seen the cultural perception of Botox change, and why do you think it's became so mainstream?
Man, Botox has become huge. I think around the year 2015, a lot of times on TV, you would see the Kardashians, you would see different celebrities, and they talk about Botox, they talk about fillers, they talk about these cosmetic procedures, whether it be a nose job or breast deals. I think through social media, entertainment, these procedures have become more available to the general public. So the more that we see the entertainers, athletes, even people maybe in politics, the more that they talk about these procedures and the more that they expose the general public, I think the world gets smaller and information is readily available. So you can go on Google and type in Botox or type in fillers. It'll give you videos and patient testimonials. So the information is out there, and the more information that patients are looking into, the more we as healthcare providers have to continue to make sure that we're on top of the latest treatments. We know what is going to be good for our patients, but also what may cause more problems. So you just have to continue to stay sharp, to continue reading, continue to just expose yourself and put yourself in these positions so we can stay up to date and the latest on the technology and the treatment.
What are some of the biggest myths or misconceptions about Botox that you'd like to clear up?
I think some of the biggest myths about Botox is that it will treat and prevent all fine lines and wrinkles. You have to understand that Botox is going to be good for some people or some patients, but it may not be good for other patients. We also have to understand that just like any other medication, it affects people totally differently, whether it be because of your metabolism or your own body differences between somebody else. So you have to know that your Botox experience may be different from another patient's. You cannot assume that you need the same amount as another patient, and you cannot assume that your effects will last the same amount of time as another patient. For one patient, one treatment of Botox may last 90 days, where somebody else it may last only 30 days. So you have to understand that there are going to be some differences between your experience and someone else's.
Can you walk us through the safety aspects of Botox? What should patients be aware of before getting the treatment?
That's a good question. So some of the things to be aware of about Botox treatment is that it can cause bruising and swelling in the areas of where you are being treated. So we talk about this with patients beforehand to make sure they have a clear understanding of what we're treating, but also the possible complications from Botox treatment. So it's definitely important not to go into direct sunlight after getting treatment for at least 24 to 48 hours. Avoiding alcohol intake for 24 to 48 hours as well before and after the procedure. And just making sure that you wouldn't do anything strenuous as far as activity right after receiving the treatment. And just try to take it easy. Don't do nothing extra.
Right. Botox is widely known for its cosmetics uses, but it also has medical applications. Can you talk about some of these and how they help people?
For sure. So some of the things that we talk about as far as non-aesthetic uses for Botox, a lot of times patients will come in with TMJ or muscle pain, and we can use Botox to treat these areas as well. If you have any muscle hypertrophy, say if you have large jaw muscles and you want to slim those down, we can also use Botox to treat your masseters to decrease the size of them, and that'll change your facial form as well to give you a more heart-shaped face. So things like TMJ, things like muscle spasms, and also hypertrophic muscles are other treatments or other indications to go and seek Botox.
How have trends in cosmetic treatments evolved, and where do you see the future of Botox and similar treatments heading?
I think there's definitely been an extreme in cosmetic procedures, especially within the past, I would say, 3 to 5 years. Again, with social media, we see patients who come in, or rather, we'll see patients on social media that have had a ton of cosmetic procedures, a ton of Botox, a ton of fillers, and you can tell that they've had these procedures. Where on the other end of the spectrum, there are people that receive Botox and receive fillers and they look refreshed. So it depends on the patient, it depends on the surgeon and the provider as well, making sure that they are equal in their expectations and the result in mind, right? So it's just important to cut those standards before any treatment is done. And it's important for me to also make sure that I do no harm and I do the best for my patients. So if you come in, you ask for something that I may not agree with, we may not be the best fit, but that's important to discuss and make sure we're on the same page prior to treatment.
Without breaking confidentiality, could you share some patient stories where Botox had a significant impact on their life?
Yeah, I could definitely remember in residency and in fellowship treating patients with temporomandibular disease or TMJ disease, where they have pain, they have headaches, and his overall quality of life has decreased because of this condition. So I remember there was actually a 60-year-old patient that I treated for TMJ. She had back of the neck pain and also headaches frequently, to the point where she was unable to open her mouth, whether it's to eat, to talk. And so we actually treated her muscles and TMJ with Botox, and she was able to get some relief, and also it improved her quality of life. So I think that's something that definitely stuck with me. I made all that up too.
How do you balance the ethics of cosmetic enhancement with your practice? What's your approach to ensuring patients have realistic expectations?
Man, that's a great Great question. I think the most important thing to make sure that we have realistic expectations for treatment is open communication. I think part of informed consent is making sure that you can discuss a treatment in layman terms. And that just means that we have a conversation, that it's not a bunch of medical jargon, it's not something that's going to be intimidating, right? Sometimes we as healthcare providers can talk over the patient's head, so it's very important to meet the patient where they are, speaking in a way that the patient understands, also being able to have open communication where the patient feels like they can ask you questions afterwards. So it's all about communication and making sure that expectations are met prior to any treatment, and just making sure we give the patient 100% every single time. East Atlanta surgeon.
When you delve into the science of how Botox works at a cellular level.
Oh, hey, I didn't see you there.
How it works at a cellular level, and why does it have the effects that it does?
That's a great question. So Botox is actually derived from Clostridium botulinum, and that's just a bacteria that produces one of the most potent toxins in the world. And so Botox actually acts on the presynaptic vesicles in the neuromuscular junction. That's a fancy way of saying that this drug is going to work on your muscles, and it prevents the release of a chemical that allows you to contract your muscles. So if you are not able to use your muscles, say in the face, this will smooth out the area, and it appears as if you have less fine lines and wrinkles. So that's a very important question of knowing how Botox is preventing or treating fine lines and wrinkles in the face.
How does Botox compare to other cosmetic treatments available today? When would you recommend one over the other?
So that's a good question. I think it depends on the patient. So if you have, what was the question again?
How does Botox compare to other cosmetic treatments available today? And when would you recommend one over the other?
So how does Botox differ from other cosmetic treatments? And when would I suggest Botox over other treatments? So Botox is a non-surgical cosmetic procedure, and that just means that it's less invasive, and that overall the recovery time is going to be more straightforward than a surgical procedure. So non-cosmetic or non-surgical cosmetic procedures include Botox, fillers, CO2 laser, microneedling, radio frequency. So some of these things are very common to the general public now. But if you're thinking about Botox, you're thinking about receiving Botox treatment, the first thing I would suggest is doing research, making sure that you go and look for a provider that is certified and that has experience in delivering Botox and also has proven to be able to give predictable results. I think that it's important to discuss the different age groups that also are seeking Botox now. Like we said earlier, because of social media, information being readily available, patients who typically would seek out Botox in their 40s, 50s are now seeking Botox at an earlier age. So you have patients in their 20s, early 30s seeking Botox for preventative measures. So that means they may not have fine lines and wrinkles right now, but they're actually coming in for treatment of Botox to prevent fine lines and wrinkles from developing and becoming very strong. The other treatment for Botox is for dynamic wrinkles, and we talk about muscles that have been moving, patients who have started to age. We can see more definitive lines and wrinkles in the face, and that is a reason why some patients will go ahead and say, hey, I want to start getting Botox to prevent these wrinkles from getting any deeper. Now, once you get into lines that may be fine lines and wrinkles that may be in the face at rest, then at that point we have to talk about other treatments for those patients.
Let's talk about social media. This could be a whole, like your first YouTube. The role of social media. How does social media influence the demand for Botox and other cosmetic procedures, like you said?
So how has social media influenced the role of patients or people in general seeking Botox and cosmetic procedures in general? Overall, I would say that social media is probably one of the biggest contributors and driving factors for patients now seeking Botox, fillers, and cosmetic procedures, things that are so readily available. We see it in the news, we see it in entertainment, we see people who are famous in our face every single day, and a lot of these people are also patients. So I think it's important to understand that some of this is influenced by social standards, but then also on the other side of it, think about the physicians, the healthcare workers that are providing this treatment. We are also contributing to this because we are providing, we're advertising, we're marketing these services. So it's a whole loop, right? And we're all feeding with each other. And based on research and based on how things are going, cosmetics is just going to continue to get larger and larger, and the field is getting bigger and bigger. So it's important to understand what these treatments are, what the complications might be, so we can all be on the same page and make sure that we can produce what y'all are looking for.
That's right. What advice would you give to medical students or young doctors interested in specializing in cosmetic treatments like Botox?
So what would I recommend for younger students, whether it be med, dental, college students, or even people that are actually training right now that may have an interest in cosmetic procedures? The biggest thing is mentorship. Finding a mentor that is providing these type of services and asking or finding out a way to shadow them, because the more experience and the more that you're exposed to as a student, the more that you will be able to be ahead when it's your time to start training and do these things. Put yourself in the right position, making sure that you looking for places that have what you need, but they may not need what you have. And what I mean by that is, if your mentor is able to provide you with a space that is going to help you grow, and then they're going to pour into you, that's where you want to be. You don't want to go somewhere where they need you to perform and they need you to be, I guess, whether it be an employee or help. You want to be in a position, you want to be in an environment where you can grow, and you have to have somebody who's willing to teach. So it's very important to make sure you select the right mentors, making sure that you expose yourself to these procedures, and just learn as much as you can before you're actually the person who's going to be providing these services. Because at the end of the day, we want to make sure that we provide safe treatment. We want to make sure that we provide treatment that is going to be best for that patient, and we give great results as well.
This is about the future of aesthetic medicine. What advancements in the field of aesthetic medicine are you most excited about, and how do you think the industry will evolve in the next decade?
So some of the most exciting advancements that I have noticed in the cosmetic world definitely have been surrounded about or have been involved with AI and also automation. I think that now that patients come in, we actually have the ability to do a facial scan, which can then tell patients what problems or deficits that they may have, and the patient can see in real time both their problems and then also the predicted treatment to enhance what they're looking for. So I think the ability to have a patient see themselves on a screen both before and after treatment is going to be something that's really going to separate providers in the future. So just like you have smile design where a dentist can map out or draw the teeth before they're even done, it's the same way with a cosmetic procedure. If a patient has, let's say, fine lines and wrinkles, or they have jowling, or they have platysmal banding, you can see in real time on the scan, on the TV, the end result after a facelift, after a brow lift, after a eyelid surgery. So being able to show patients before going through the actual procedure itself is really going to set us apart in the future.
Have you ever tried Botox or other treatments yourself? How did that experience inform your practice?
Have I ever tried Botox or filler myself? No, I have not. That's actually a good question. It's crazy. I've not ever received Botox or filler. And again, that's just a personal preference, not to say that I would or would not. I just felt like for myself, I didn't need it, so therefore I didn't go ahead and pursue and get that treatment. But that's a great question.
I have not done it. I haven't got veneers either.